Explain a hair transplant from pre-procedure, procedure, and post-procedure. So in the pre-op phase, we're basically meeting you and we're doing a full consult. We're sitting down with you and learning exactly what's important to you in terms of your new hairline. We're designing a hairline that's absolutely customized and curated to you and your facial dimensions, and also in terms of what you're looking for aesthetically. We blend all of that together and also come up with a graph number for you and a plan, also a medical plan in regards to any medications that you should be taking or any medications to continue or stop. Basically compile all of that information in a way that helps you best. So it's really an in-depth process in getting to know you and learning how best to help you with your hair loss journey. We want to tailor this transplant to really what's going to impact your confidence the most and really give you that feeling of being yourself again and not having to wear a hat or worry about any of these things. So for procedure day, things to look forward to. You're gonna come in the morning around 7:15 or 7:30, and you'll be filling out paperwork initially. But the fun part comes soon. You'll then be stepping into the office, we'll redraw your hairline, and then we'll just basically solidify and go over the plan that we have for you that day. We'll then head into the OR, where we'll give you medications to help you relax during the procedure. This should be a very easy, restful day. Put all your phones away and pack all your worries aside, because this is going to be your day to really transform. We'll put on your favorite music, and then we'll start the process by giving you local anesthesia through the needle, where we're basically numbing you throughout your entire scalp so that you don't have any pain during the procedure. We're also giving you medications during that time, such as laughing gas, to help you calm down during that process. And we'll start by making the recipient sites, which are essentially made with a microblade. These are the areas that the hair will be transplanted into after the extractions are performed. After the recipient sites are made, we then move into the extraction phase, where we have you laying in a face down position, and we start by making tiny micro incisions around the follicular units. We pull them, count them, sort them, and then place them immediately in a process known as simultaneous extraction and placement, so that your grafts have minimal out-of-body time. We do this in phases so that your grafts are not sitting out for a long period of time, giving you the best survival of all of your grafts. Then we move into our post-operative phase, and that's basically explaining how exactly you'll take care of your grafts for the next few days. We extend that phase into the next day, where you come back and you receive a hair wash, fully instructed by our technicians, and they will teach you exactly what to do for the next few days on your own so that you feel confident in taking care of your grafts.